Dr. Michelle Pennie. I'm the founder of Bliss Dermatology Wellness. Today I'm going to be talking about a technique that I use called Slow Mohs surgery. So I specifically use this for treating melanoma in situs or early melanomas, particularly on the head and neck. So it is a technique that I use to precisely remove all of the melanoma cells, evaluate 100% of the margin, and get some of the highest cure rates with this technique. So why is this called Slow Mohs? So in the typical Mohs surgery technique that we use commonly for basal cell or squamous cell skin cancers, we actually freeze the tissue and process it in the lab in my office. That process does not work as well for the melanoma cells. They are a little more subtle and more difficult to see under the microscope with the frozen sections. So for the melanomas, we send it for what we call permanent section processing, and that happens overnight. So we get the results the next day. Thus, it's a slower process than our traditional Mohs technique. So some more details about the Slow Mohs process. So after the initial biopsy that gives us the diagnosis, we may determine that the Slow Mohs technique would be the best treatment of choice. So we can discuss in consultation what's involved and schedule that appointment. So typically that procedure is done in the office. We use just local numbing medicine to numb up the area. I will mark the pigmented area and then a small margin around it, and that will be the area that I will excise on the initial stage. After that's done, we put on a bandage that just stays on overnight, and patients can go home and rest. And then we see them back the next day, and we have the results the next day. If all of the margins are clear, then we go to doing the repair reconstruction. We do get a positive margin. We're able to map it out. So we may know at 12 o'clock we have a positive margin, so we'll go back in that area, take an additional margin, and again, send that off for processing and get the second stage results the next day. The way that we process the tissue is different than a standard excision. So in a standard excision, they do something called bread loafing, which is just a sampling. Imagine if you had a piece of bread and you were cutting it in sections, and just those sections are all that's evaluated. So in reality, only about 1 to 3% of the margin of tissue is examined that way. When I do the Slow Mohs technique, the tissue is processed differently. So the analogy I like to say is maybe a pie. So I'm looking, the filling of the pie is the cancer cells, and the pie crust is the normal tissue. So I'm looking at 100% of that crust to make sure there's no cancer cells in the deep margin or in the peripheral margin. So by evaluating 100% of the margin, we can get a much higher cure rate than we can with the standard excision technique. Patients that have a diagnosis of a melanoma in situ or early melanoma might be referred out to a general surgeon or plastic surgeon, which would typically do a standard excision technique. Again, without being able to evaluate 100% of the margin, the recurrence rates may be much higher. The range of recurrence can be from 6 to 20%, which is very high. With the Mohs surgery, Slow Mohs technique that I'm able to do in office, I can get cure rates down and recurrence rate down to just 1 to 2%. Once we're able to get clear margins, then I can do the reconstruction in the office as well. Again, being able to do everything in the office just reduces the need for additional appointments, expense with surgery center time. So really being able to do everything here in the office for patients makes it's time saving, it's cost saving, and really get great clearance rates and results for patients. After the repair and reconstruction, we'll provide aftercare instructions, how to take care of the wound over the next 1 to 2 weeks. We usually do a follow-up in a week, make sure everything is healing well. If we need to do any work on the scar, we have lots of great techniques with silicone scar gel, lasers, and different techniques really to minimize the scar and make sure that we get beautiful results. To learn more about Slow Mohs surgery and other techniques we have for treating, preventing skin cancer, please subscribe to our YouTube channel.